Friends, welcome to the yoga session, part of Outpace Parkinson's program. I'll take you on this journey of doing yoga and simple set of exercises which will help you to improve your Parkinson's symptoms and to slow the progression of the disease. I would give you a word of caution here. If you're suffering from an illness or an injury which might affect your health in a negative way, then please consult your doctor and make sure that you are suitable to do yoga. Now, I need to explain you about the yoga program. So we will be doing some loosening exercises in which we call them Sukshma Vyayam in Hindi. These are the exercises to make your joints loosen up before we embark on the journey of yoga. Then we will be doing postures in sitting, lying on our back, lying on our tummy, standing, and then there will be breathing exercises which we call as pranayama. Prana means life breath, yama means control. And this will help you to control your breath, improve your life breath, improve the energy flow in the body. The third part of any successful yoga program is meditation. We have done meditation in a different session, but we can take a small meditation in this program as well. And after that, the program ends with the vibrational chanting to heal the body. Welcome to the journey. So first, make yourself comfortable on your mat. If you can't sit on the mat, you can even sit on a chair. That's okay. And you can sit cross legs like this. The way I'm sitting, it is known as comfortable pose. So you are just cross legs. You can also sit in a different way, which we call a Siddhasana, in which your heel is next to the groin and the other heel is on top of it. Siddhasana. And you can sit like this. The other way to sit is in lotus pose or Padmasana, where you keep both legs straight. Now you bend your left knee, bring your heel onto the right thigh like this. Then you bend the other leg and you bring it on the top like this. So you can even sit like this, but this can be a bit more uncomfortable to you. So I think most of the people prefer just simply sitting like this. Another way to sit is to sit on your heel. This is called as thunderbolt pose. You just sit on your heel like this. So let's sit in the comfortable pose or Sukha Asana. Asana means postures. So we sit in the comfortable position like this. Now we will do the loosening exercises. Bring your hands in front, straight. Move your hand up and down, up and down. Gentle and slow. Now face them like this. Rotate sideways. Now make like a claw. Bend all the interphalangeal joints or your fingers and then relax. Bend, relax, bend, relax, bend, relax. Now make a fist with your thumb inside and rotate your wrist outwardly. And then inwardly. Very good. Now inhale, take a deep breath in, and when you exhale, open up your fist. And relax. Now again, bring your hands on your shoulders. Go forward and back. sideways. And relax. Now we will do the shoulder rotation. In shoulder rotation, you move your shoulders up, forward, down, back in a circular fashion. Big circle. And then reverse. Again, big circle. It's not just shrugging of shoulders, it's a big circle. Shoulder pain, frozen shoulder, all these issues can come in Parkinson's disease. So we definitely have to take care of our shoulders. And relax. Now bring both hands again on your shoulders, elbows in the front. Now bring elbows in the front, up, side, back, down. Again, make a big circle with your elbows now. Opening up your chest. Really big. Remember, in Parkinson's, all movement should be big. And then reverse. And relax. Now I'll do the isometric neck exercises. A lot of Parkinson's patients can have neck pain, and that's also because of a stoop posture or a hunchback. So hold your hands like this, clasp your hands, push against your head. So here you're not bending your neck, you're keeping it straight and putting resistance of your hands against your head, which is you're pushing backward. Now on the forehead, on your left, on your right, on your chin, again, back, forehead, on your left, on your right, on your chin, and relax. Now turn yourself on the mat, stretch out your legs, arms behind your back. Now I'll do the neck rotation. So when you go back, you inhale, coming forward you exhale. Touch your ear to the shoulder, chin to the chest, big circle again, gentle and slow. Coming forward, exhale, breathe out, going back, inhale, breathe in. Really good neck exercise. Now reverse, exhale forward, inhale back. And relax. Now bring your attention to your toes. Bend your toes forward and relax. Bend your toes, relax. Bend your toes, relax. Now move your ankle forward and then backward, forward and back, forward and back, forward and back. Now fan out your toes, open up your toes and relax. Again, open up your toes and relax. Now rotate your ankle, make a big circle. Try to touch side of your feet to the mat. And again, remember to take a big circle. Gentle and slow, and a big circle with full range of movement. Now reverse, go anti-clockwise, gentle and slow, and relax. Have a gap between your feet. Bring both toes together in the middle and away. Together and away. Together and away. Now nice and relax. Bring your fist between both thighs and try to squeeze your fist with both thighs. Make it tight and relax. Tight and relax. Tight and relax. Bend your right knee. Hold your right thigh with both hands and make a big circle. Really big. Reverse. And relax. Bend your left knee. Hold your thigh with both hands. Make a big circle with your left knee. Really big. Reverse. And relax. Now tighten up your kneecap and relax. So make your kneecap tight and relax. Tight and relax. Tight and relax. Now lie down on your mat. Arms on your side. Take deep breaths. When you breathe in, your abdomen and chest goes up, and when you breathe out, it goes down. Try to have longer exhale than inhale. This activates your parasympathetic or rest and relax system. Breathe in, breathe out. Breathe in, breathe out. And relax. Let your breath take its own rhythm. And relax. Now stretch out your arms. Bring both feet together. Lift your right leg up. Knee straight. Keep going up as long as you can go. As far as you can bring it up. And now make a big circle again. Really big. Try to bring your heel as close to mat as possible. And then reverse. And relax. Lift your left leg up, knee straight. Again, big circle. As big as you can go. Reverse. Big circle. And relax. Bring back your hands. Let your breath take its own rhythm. Now bend both knees and lift your hips up in the air, back up, bridge pose. It's really good for your back, improves your endurance. Now move your feet forward without lifting your feet or toes up in the air. And now stay in a pose for a while. In yoga, once you know the poses, it's good to internalize yourself by closing your eyes. And slowly come down and relax. Now we will do the spinal twist. In a spinal twist, you stretch out your arms, bend your knees. Now bring both knees to the left and the face to the right. So your right ear is touching the mat, left knee is on the ground, right knee on the top of it. Feel the twist across your spine, stretch across your spine, squeezing off the internal organs. It's really good for your spine and for your abdomen. Normal breathing. Now bring both knees to the right, face to the left. Again, bring to the center. Again, both knees to the left, face to the right. Normal breathing. Bring both knees to the right, face to the left. And bring to the center. Straighten up your knees, arms on your side, and relax. The relaxing pose in supine position is called as corpse pose, like a dead body. The whole body relaxed. Now we'll do the shoulder stand. In shoulder stand, you bend both knees and you lift your legs up in the air. If you have difficulty in doing this, you can take the support of a wall. Please don't do this if you have a neck issue or high blood pressure or any other condition which can make it worse. Slowly come down. And relax. You must relax between each posture because yoga is about relaxation. relaxing your mind, relaxing your body. Now bend your right knee. Hold your right knee close to your chest. Inhale, and when you exhale, bring your forehead to the knee. Stay there. Your left leg is straight, toes pointing outward, and your right knee is touching your forehead. And slowly release. Bend your left knee. Hold it close to your chest. Inhale. When you exhale, bring your forehead to the knee. Stay there. This is very good for your abdomen. While the previous shoulder stand is good for the brain, shoulder stand is considered to be the king of asanas. Again, bend your right knee, hold it close to your chest. Inhale, when you exhale, bring your forehead up. Touch your forehead to the knee. Stay there. And relax. Bend your left knee, hold it close to your chest. Inhale, when you exhale, bring it up. And release. Now bend both knees. Hold it close to your chest. This is also known as Pavan Muktasana, or the wind releasing pose, because it gives away all the abdominal distension. Come up to the sitting. And relax. This is good for your abdomen, relieves constipation, and also good for your spine, giving it a good massage. Now the next one is the boat pose, or Nauka Asana. In this, you lift your legs up and your shoulders up. So you are trying to balance yourself on your lower back. Feel the stretch across your abdomen. It improves your endurance power. And relax. And go into the relaxing corpse pose. Now gently roll your body to the right and lie down on your tummy, arms on your side, chin on the mat. Try to stretch your chin as much as you can. This is good for your thyroid, parathyroid, for your larynx, for your neck. Now bend both elbows, bring your hands at the level of shoulders and lift your body up. Cobra pose, Bhujangasana. Again, good for your neck, back. This is also good for people having carpal tunnel problems. It is helping to extend your wrist. And slowly come down. Lie down in the relaxing pose. Bend your elbows, cheek over your hand, legs apart and toes pointing outward. Relaxing pose in prone position. Now we will do the locust pose. In locust pose, you bring both hands below your thighs, hiding below your thighs, feet together. Now you just lift your legs up in the air. And slowly come down. And again, relax. Now, bow pose, bend your knees, hold your ankle with both hands, lift your knees up, shoulders up. While you are in this pose, you can also roll onto the sides, gently and slowly. Give good massage to all the internal organs in your abdomen. Relieves distension, constipation. And relax. Go into the relaxing pose. Relax. Now we'll do the last exercise in prone position, in which you lift your left leg up and right arm up and chin up. And slowly bring it down. Do it on the opposite side. Left arm and right leg up. And slowly bring it down. And relax. This is the other relaxing pose. In this, your right arm and right leg is straight. Left arm is bent at the elbow and right knee is bent. Right heel is touching the left knee. Now slowly we will get up from this position by using both hands, turning your body to the right. And come into the sitting position, comfortable pose. Now I'll teach you a gesture in yoga which is very useful for Parkinson's patients. It is known as air gesture or Vayu Mudra. Vayu means air, Mudra means a gesture. So what we do in this one is that you bend your index finger of both hands and you hold it with your thumb at the base of thumb. Rest of the fingers are straight. This is known as air gesture. This helps to relieve Vata doshas, and Parkinson's disease is a Vata disorder in Ayurveda. So you keep your hands like this, and you can keep your hands like this if you're watching telly or you're not doing anything, or even if you're doing something with this hand, you can keep the other hand like this. So it is very simple and easy to do. Now we'll do some acupressure points which are quite useful. We'll start with the left hand. So you press all the nail beds hard enough so you feel slight discomfort, and do it at least twice. And then press in between the knuckles, the space between the knuckles, again twice, and in the middle of the palm. So what happens is, now do it with the right hand. Acupressure points, they are connected to the other organs in the body. Then press in between the knuckles. Do it twice. And in the middle of the palm. Let's do the same on our feet. So start with your big toe, second, third, fourth, fifth. Do it twice. And now press between the toes. And in the middle of the sole. Try with the other foot, big toe, second, third, fourth, fifth. Do it again. Middle of the toes. And relax. You can keep your hands like this. I'll teach you a posture which helps in digestion, and this is the one which you can do after your meals, sitting like this for a couple of minutes after your meals on your heel, thunderbolt pose or Vajrasana. It helps in digestion. So if you are having delayed gastric motility, constipation, flatulence, you can try this. Now another one which should not be done after meals, to be done empty stomach, but good for your stomach, is holding your right wrist with the left hand behind your back. Inhale, and when you exhale, bring your forehead forward, forward, forward. Touch your forehead to the mat, but don't lift your hips from the heel. Keep them there. And slowly come up. Let's do it once more. Inhale, and when you exhale, bring your forehead down. And slowly come up. And relax. Come back into the sitting position. Now we'll do some breathing exercises. So in these breathing exercises, we need to understand what we are doing. First and foremost thing is, when you are doing breathing in, the body should expand out. So I'll show you by sectional breathing, which means we will take one part of the body one by one. So let's focus on our abdomen. So when you are doing abdominal breathing, your abdomen is going out like this. And when you're breathing out, it goes in. So breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Now focus on your chest or thoracic breathing. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. And now we will do the shoulder breathing or the clavicular breathing. So the shoulders goes up and back. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Now we'll do the complete breathing or the yogic breathing, in which abdomen, chest and shoulders goes out when you breathe in, and everything collapses when you breathe out. Let's do 3 counts of deep breathing, complete breathing. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Also to remember to have a longer breathe out than breathe in, which brings you into the rest and relax phase of parasympathetic system. It calms your mind, it calms your nerves, it decreases your anxiety, decreases your tremors, decreases your stress, improves your sleep. Even simple deep breathing can be very useful. Now we will go to the next session of pranayama, which is the forceful exhalation breathing or the skull shining breath, which is known as Kapalbhati pranayama. What happens here is you forcefully exhale and there is some passive inhalation happening. So we do it at the speed of 1 per second. It needs a bit of practice, and doing this practice needs a bit of effort on a regular basis. But you can use your hand, keep it on your stomach, and then see what is happening when you're breathing out. It's going in. So we will do it for a couple of minutes, 1 per second. Just forcefully exhale. So you're trying to bring your belly button closer to your spine, hitting it backward. And stop. When you stop, don't look to take next breath. There is a spontaneous cessation of your breath, and with that of the mind, and you enter into the deep bliss and peace. So the next breath will come after a gap. Watch the changes in the body. I want to give you a tip about this forceful exhalation breathing exercise. This is very, very effective in chronic disorders. It is good to improve your digestion. And you can also add an affirmation with this. When you're breathing out, feel the negative energy is leaving your system, or the toxins, or the stress, or Parkinson's symptoms like pain, tremor, shake, stiffness is leaving your system. So you can contemplate in your mind when you're forcefully exhaling, 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 exhaling. So that has more effect. Now the next one is alternate nostril breathing. In this, what we do is with our right hand, we bring the index and middle finger down. The right thumb is used to close the right nostril, and the right ring finger is used to close the left nostril. So there is an alternate nostril breathing, means you inhale from the left nostril first, then you exhale from the right nostril, you inhale from the right nostril, and you exhale from the left nostril. Now between this inhale and exhale and inhale, there is always a pause. Longer the pause, it's better for you, because that's what all this is all about. Let's start. Keep your hand like this. The other hand I have kept it in air gesture, which is good for Parkinson, so you can still keep it like this. Now this hand, with your right thumb, you close your right nostril, you inhale from your left nostril in, long and deep breath, close your left nostril with the right ring finger and breathe out from the right nostril out. Then pause, and after this pause, inhale from the right nostril in, close your right nostril and breathe out from the left nostril. Breathe in from the left nostril Close your left nostril, breathe out from the right. Breathe in from the right. Close the right nostril and breathe out from the left. Breathe in from the left. Close the left and breathe out from the right. Breathe in from the right. Close the right nostril and gently breathe out from the left nostril. Breathe in from the left nostril. Close the left nostril and breathe out from the right. Breathe in from the right. Close the right and breathe out from the left. Breathe in from the left. Close the left and breathe out from the right. Breathe in from the right. Close the right and breathe out from the left. And relax. You can bring the right hand again into the air gesture. Close your eyes and observe the sensations in the body after you finish doing alternate nostril breathing. In Sanskrit, we call it Nadi, Shuddhi, Pranayam, which means Nadi means nerve, Shuddhi means purification. So this breathing exercise purifies the nerves. It opens our energy channels. We have two energy channels according to yoga, Ida and Pingala, right and left, and in the middle there is Sushumna. And when you do alternate nostril breathing, it opens up the energy channels. The energy starts flowing in the middle one, and it helps to calm your mind, relax your body. This is good to decrease your tremors. The one before this one, which was forceful exhalation, is good to improve your balance. If you're sitting on a chair and you can't get out of the chair, you do few of these forceful exhalations, and that will help you to get that energy to get out of the chair. So these are the practical implications in Parkinson's disease of these breathing exercises, which we call pranayama. Now we will do another pranayama, which is known as humming bee sound or Bhramari pranayam. In this, you roll your tongue, tip of the tongue is touching the hard palate, and you make a humming sound. We'll do 9 counts of it. Roll your tongue like this. Take your deep breath in and make a humming sound. more time. And relax. Watch the sensations, vibrations in the whole body. Each and every cell of the body gets good massage by this humming bee chanting. Bhramari pranayam. This is good to decrease anxiety, calm your mind, improve your sleep. It's good to decrease your tremors. And there are more implications of it, especially when you roll your tongue. The tongue has very rich afferent and efferent sensory supply from the brain stem, from the part of the brain where there is problem in Parkinson's disease. So let's say if you have problem with your balance, you roll your tongue, you make this sound, and then you try to do a toe walking, heel walking, or a tandem walking, and that will improve your whole condition, because this is a good connection to the brain, and the brain has plasticity. It can change and it can recover. So when you do with this chanting any exercise, it potentiates the effect of that change in the brain. Now we'll do the standing exercises. So stand on your mat. So let's stand. We'll do the standing postures. Arms on your side, feet together. Now lift your arms up. Inhale. At the level of shoulders, face your palm upward and keep bringing your hands up. Join them together in the middle and stretch as much as you can. Stretch, stretch. Stay there. And slowly come down. Let's do it once again. Inhale. Join them together and stretch, stretch as much as you can. And then slowly come down. Now we will lift our toes up when we do this. So you inhale, go back again, and then lift your toes, lift your heels up so you're on your toes now, and stretch your arms. Now in this position, you can also walk. And you can also walk on your heel. And to improve the effect of your balance and walking, as I explained before, you can do the humming bee sound while you're walking or doing any balance exercise to improve it. So you roll your tongue and make a humming sound like this. And you can keep doing this as well as you can keep walking. And relax. Now the next one is half wheel pose. In half wheel pose, you lift your right arm up. Inhale at the level of shoulder, palm facing upward. Stretch, stretch as if you're hanging on this hand. And then turn your body to the opposite side. Stay there. And slowly come back. Now do it on the other side. Inhale. Stretch your left arm. Keep it straight. Now exhale, bend your body to the opposite side. Stay there and slowly come back. Now I'll do the 1 foot hand pose. You bend your knee, hold your foot with both hands and bring it up. If you have difficulty with balance, you can do it with help of a wall, support of a chair. And slowly come down. Sometimes these exercises are difficult on the mat, so you can do off mat as well. Bend the other leg, bend your left knee, hold it with both hands. And bring it down and relax. Now we will do an Agni Sar Kriya, or to improve the digestive fire. In this, you bend your knees, put both hands on your knees and open your mouth, and you inhale and exhale from your mouth. While you're doing this, the abdomen is going in and out, let it go. Then you completely exhale, close your mouth, you don't breathe, but your abdomen keeps going in and out as long as you can do that, like this. Without breathing, abdomen is going in and out. And relax. So let's do this once more. Open your mouth, tongue out, exhale and inhale from your mouth. Completely exhale, close your mouth, abdomen in, out, in, out, in, out. And relax. So this exercise is to improve your digestive fire, which means improves your gastric motility, improves your digestion, relieves constipation. So this is good. Do as first thing in the morning, but never to be done after having your meals. As a matter of fact, you should not do yoga after having meals. So it should be done empty stomach, morning or evening. It's your choice. Now another component to this yoga program is laughing exercise. As we know, in Parkinson's disease, there is loss of facial expressions because there is less movement of the facial muscles. And sometimes we call it a poker face. How to get rid of it? How to improve the facial muscles movement? So we do the laughing exercise, and we have divided into 3 types. One with mouth closed, the other with mouth open, and the third one with the tongue out. Another important thing, as we know, with laughing, even if you do it fake, it releases good hormones, good neurotransmitters in the body, increases your dopamine and serotonergic system, relieves depression, improves your general health. So there is no harm in doing a big laugh every day. So let's do it after taking a deep breath in. Okay, now we'll do the normal one with the mouth open. Take a deep breath in. And you know, this artificial laugh can bring a smile on your face. Now the next one is with your tongue out. So take a deep breath in and tongue out. Very good. Now when you do with the tongue out and you make a big laughing sound, that also helps with your voice. So you know, in Parkinson's, your speech can become very soft and shallow, and it helps to improve that. It also helps to improve your swallowing reflex. So this is a lot of useful, and you can do it anytime. You don't really have to do with the yoga class. You can do it as separate at some other time, a couple of times a day. While we are doing this, I want to show you walking meditation, which has a very, very big impact in Parkinson's disease. What is meant by walking meditation? It comes from the Buddhist tradition in which you can make your walking also as a meditative technique. So what we do is, when you walk, first thing is you should not be talking to anyone while walking, and you'll not be taking a phone call. So you just focus on one task at a time, just your walking. And it's a blissful walking, attentive walking, in which you focus on each feet, movement of your arm, and you are giving a deliberate attempt to move your arms and having increased stride length, which can be an issue in Parkinson's disease. Moving your arms and moving your feet. So what happens in Parkinson's disease when we walk? When we walk, the arm movement is slow and it is a decreased arm swing, and the leg can shuffle, and so it looks odd, and then it can make you stumble and you can even fall. So how to improve? Think yourself as you have changed from a auto car to a manual car. In auto mode, you don't have to change gears, you just keep driving. But now you have to be attentive to your walking, and you have to be attentive to change gears, press the clutch. So in this case, let's say if you're walking, you have to pay attention on your arm swing and the stride length. And if you pay attention, you can do everything right. So it's all about attention. And no dual tasking or multitasking, just focus on one thing at a time.